Hey, everybody. Good morning. My name is Johnathan Keller. It's happy to be back and see at least some familiar faces. I am, as John said, the former director of Right to Life. I first met John, I think, in either 2003 or 2004 when I was the youth director for Right to Life, and John was one of the youth I was directing. So John is doing phenomenal work. I am so thrilled that he is the executive director here at RLCC. I think he and the new team are doing a phenomenal job. And I was saying actually to Karen Spencer, who was my board chairman when I was at Right to Life as the executive director, that I really feel old when the youth that I was directing are now the attorneys that are leading the organization. So it's fun to be here, though. In my new job with California Family Council, as John said, we are focused on the pro-life issue. We're a little bit more broad in terms of the things we talk about. We do, our mission statement is advancing God's design for life, family, and liberty through California's church, community, capital, and culture. So today I want to talk about the first one of those three, the life issue, and I want to specifically talk about it from the capital perspective. As you guys might imagine, being there in the state of California, I'm just realizing, am I completely, by walking side to side, walking out of the camera every time? Is that okay? Does it matter, Raphael? Sorry. Okay, I'll try to stand still. I apologize. This is going to be tough. Okay. One of the things that we have got to do over the last several years that I've been at California Family Council is spend a lot of time up in Sacramento looking at legislation and seeing the ways that it impacts the fight for the sanctity of human life. This may come as a shock to some of you, but the Capitol actually is not very pro-life. I know that is kind of blowing your mind, I'm sure, on Saturday morning. I'm sorry to bring you such jarring news so early in the morning. But it really has been kind of incredible for me to see the ways that legislators in Sacramento try to invent to score points with Planned Parenthood and NARAL and their base. When you're in a state like California and you already have abortion legal essentially through all 9 months, you already have in the state of California Planned Parenthood being funded not just with federal money, but we go out of our way to try to fund them with additional state money. We're one of only 15 states that funds abortions directly through Medi-Cal. We're one of only 3 states that refuses to participate with the Centers for Disease Control in reporting our abortion numbers. And we're the only state that does both of those things. We're the only state that, while we're paying for abortions with government money, we're also refusing to report how many there are. That's where we already are. So you would think, well, goodness gracious, what else could they possibly do in Sacramento to try to further push us in a pro-abortion choice direction? Well, it turns out, unfortunately, they are very creative. And there's a couple of bills that I want to talk about. John, I know we're going to talk about this during Q&A, but just very briefly, I want to mention 2 bills briefly and then one bill that's current in a little bit more depth. One bill that was passed several years ago that is going to be up for review in front of the Supreme Court is a bill called AB 775. Before we talk about it later in the Q&A, I'll just give you what happened in 2015. A state assembly member from San Francisco named David Chu. He was a former San Francisco city supervisor. They introduced a bill that said every pregnancy care center in the state of California, both the ones that are licensed medical clinics and the ones that are just kind of mom-and-pop faith-based clinics that are maybe run out of a church. There's a total of about 150, 160 of those statewide. And this bill basically said that if, depending on which one of those you are, there were slightly different requirements. But the gist of it was you either had to say, hey, we're not a medical facility, so you probably don't want to come here. I'm paraphrasing a little bit, but that's basically what it was. You had to use big, huge letters and saying, we are not a licensed medical facility. If you'd gone through all the process, like our pregnancy care center here in Fresno has done, to become a licensed medical facility, you had to post in big letters, huge font on your wall, you may be entitled to free low-cost government health care, including abortion. Here's a number where you can call, essentially referring for abortion inside the walls of the clinic. I remember being in Sacramento, inside the hearing room in 2015, April of 2015, when this bill was passed. And I remember being there with over 100 different clients and staff from pregnancy care centers around the country. You had moms with their little toddlers going up to the microphone and testifying and saying, my daughter would not be here today if this law was in effect. If I would have been sitting there in the waiting room and I would have been confronted with this, I might have been scared, I might have been pushed out. I may not be here today if it wasn't for these pregnancy centers. Please don't attack them. Please don't force them to shut down. Please don't force them to violate their conscience like this. And I'm very sad to say, but not terribly surprised to say, that that bill passed on a party line vote. Every single Democrat voted for it, and every single Republican voted against it. They voted to force these pregnancy centers to advocate a message that is explicitly against their deeply held beliefs. That's one bill, and we'll probably talk about that a little bit later in terms of the Supreme Court. The good news is that bill's going to be challenged at the Supreme Court next month, so we'll talk about that a little bit later. Another example of a bill that did not pass, a good bill that did not pass, State Assemblywoman Shannon Grove is from the Bakersfield area. She is quite a character. If you have not had a chance to meet her, she's out of office right now, but she's running for state senate for the Bakersfield seat. And she is very pro-life, outspoken, dedicated lady. She said, okay, let's try to see if there's any legislation out here. Legislation is all about compromise, especially in a state like California. Let's see if there's any sliver that we could find some common ground with people on the pro-choice side. I mean, a lot of times you hear people say, like John was saying, the old mantra used to be safe, legal, and rare. Now it's safe, legal, and accessible. But can't we at least agree that there are some cases where abortion is not good? So she introduced this piece of legislation, and I was in the hearing room for this as well. And I was just blown away at how narrow this piece of legislation was. Let me explain. How many of you have ever heard before that some abortions are committed for purposes of sex selection? In other words, I'm having a little girl, I wanted a boy. That's actually legal in the state of California, by the way. You don't have to say it's not. I'm going to be killed by my parents. I'm going to be beaten up, or oh my gosh, my husband's going to leave me. No. It could be something as simple as, you know what, we had already painted the nursery blue. We had bought a bunch of boy stuff. We have 2 boys, and we don't want to have to get all new clothes and hand-me-downs and toys. And we decided we don't want a girl. We really want a boy. So we're going to abort this child. That's legal in the state of California. As I mentioned before, it's also legal in the state of California if you're on Medi-Cal to pay for your abortion using Medi-Cal, state government money. So Shannon Grove said, okay, I realize that California is a very pro-choice state, but what if we do a bill that is so narrow that we say, look, if you want to have an abortion for sex selection purposes, we're not going to talk about that in this case. We can address that in a future bill, but for this bill, we're going to set that aside. We're also going to say if you want to pay for your abortion with government funding, we're not going to talk about that. All we're going to do with this bill is we're going to combine those two things. We're going to say, if you're going to kill your child because she's a girl, could you at least not have the government pay for it? That was the bill. It was literally that narrow. It was saying, and I hate to say this, but it was really probably it would not have actually functionally saved any children. It would have, if someone decided that they were going to have an abortion for sex selection purposes, they still could have paid for it themselves, or if it was extreme financial hardship, they could have said, well, it's going to be an economic burden, or well, it's going to be something like that. But the point of this bill was to try to reach across the aisle and try to say, among some of the Democrats in Sacramento, look, can't we at least agree that there are some cases where abortion is wrong. It's immoral. It's the taking of an innocent human life. It's not something that we should be promoting and subsidizing and underwriting with our collective resources. I'm just going to give you guys one guess what happened when she brought this bill up for a vote. Once again, along party lines, every single Democrat voted against this bill. Every single Republican voted for it. And it doesn't give me any great pleasure to tell you that. I know in this room we probably have some Republicans, we have some Democrats, we have some people who are independents. I have friends who are pro-life who are Democrats. I have friends who are pro-life who are Republicans and who are no party and another party. This should not be a Republican or a Democrat issue. This is a human rights issue. This is a civil rights issue. Just as in the era of civil rights in the 1960s, you know what, Dr. Martin Luther King was not saying, well, you know what, if you're a Republican, I don't want your support. Well, you know what, if you're a conservative, I don't want your support. No, if there are issues that are fundamental, transformational, basic human rights, those transcend political parties. But unfortunately, in the state of California, where we're at right now, we're at a position where this has become so polarized that people in Sacramento, some of the legislators there, are so afraid of stepping out of line with Planned Parenthood and NARAL. They're afraid they're going to get a primary challenge from the left that they will refuse to even break to protect the lives of girls who are being killed just because they're girls. So those are two bad pieces of legislation that are in the past. I want to talk about one that is coming right now and one that I actually think, because of the hard work of people like John, people like Anna, people like Bernadette and Students for Life at Fresno State, I think there is actually a chance, it's not a guarantee, but there's actually a chance that we may be able to stop this legislation. And it is helping to really bring awareness about this issue to a lot of especially young people. This is a bill called Senate Bill 320, or SB 320 for short. This bill was introduced by State Senator Connie Leyva, and she is from the Chino Valley area, down near Riverside, San Bernardino, if any of you are familiar with Southern California. She introduced this bill, and originally it was much, much more expansive. Originally, it would have forced every single state-funded college and university in the state of California to provide abortion medication on their campuses. Now, they've amended it down. It no longer applies to the 115 community colleges. So it doesn't apply to Fresno City, doesn't apply to Reedley College. But it does still apply to Fresno State. It does still apply to UC Merced and the 29 other UC and CSU campuses around the state of California. And what it would do is it would say that in order to continue to receive state funding at these state colleges, all of these colleges would have to begin to offer, they'd have to stock and prescribe and dispense on campus the RU-486 abortion pill medication. Now, I want to clarify something. When I've talked to people about this, even in the media sometimes, and when the Sacramento Bee ran a story about this, I don't know if they were being willfully dumb or if they were, you know, if they were just ignorant. I don't know for sure. I'll let you make your own decision on that since it was the Bee. But they basically said, they showed a picture with a op-ed of the morning after pill. And they said, these pro-life groups oppose this emergency contraception on campus. That's not what we're talking about here. We're not talking about contraception. We're not talking about Plan B or the morning after pill or things like that. There's a lot of moral and ethical problems with those, but that's not what we're even talking about. RU-486 is abortion medication that kills a child up to 8 or 10 weeks of gestation. My wife and I were really blessed to be the parents of a new little boy who was born in September. He's 5 months old now. Before he was born, we had had 2 miscarriages earlier in our marriage. Both of those miscarriages were fairly early on. They were each about 6.5 weeks. But I remember how emotionally devastating that was for my wife especially, and how physically traumatic and painful it was. This is talking about miscarriages that are 3 or even 4 weeks after when my wife and I lost those first 2 children. These are essentially medically induced miscarriages. It's a two-stage process. The first pill basically cuts off the supply of hormones that the baby needs to survive, and the second pill induces an early miscarriage and expels the baby. And by the way, guess where young girls, freshmen maybe as young as 17, are expected to go through this very traumatic and emotional procedure? Not at a doctor's office. You get the pill at your on-campus health center. You go back to your dorm room, which, for those of you who are in college right now, the good news is dorm rooms are always very sanitary, private, clean places, right? You take this medication, you go back, and literally it could take hours, it could take 2 or 3 days for the abortion process to finish and be completed. This bill, Anna gave a phenomenal testimony in opposition to this bill, and it's actually available on our website, the California Family Council website, and our Facebook page. She just did an exceptional job explaining the dangers of this bill and why Students for Life of America and their chapters across California oppose it. But this is something where, again, we saw on a party line vote, there is one bit of good news. The one Democrat senator, I think, maybe 2 Democrat senators decided to abstain from the vote on this. But generally speaking, at this point, we're still trying to ramp up a little bit. The Senate is very hard to beat things in. The good news is now this bill is in the Assembly. And now that it's in the Assembly, we think that we may have a little bit of a better chance to stop it. We have a little bit more time to ramp up. Anna and the other clubs at Students for Life have been going around to all the Students for Life clubs in the state. They've been helping do tables on campus. And Bernadette, with the help of John, did a phenomenal job. What was the name of the individual you met with at Fresno State? So he's the government affairs officer, correct? I don't want to steal too much of her thunder. You should talk to Bernadette afterwards. But John Girardi helped them get a meeting. And the good news is that here, I think largely because of the work of Right to Life of Central California, because the fact that, let me put it this way, there's not a lot of other places in the state where you have a annual event like the Right to Life Christmas dinner where you have 1,000 people that show up. You have the mayor, Jim Patterson, former mayor show up, and the current assembly member show up. You have congressmen like Jeff Denham show up. That's a rare thing. And I think because of that, even at Fresno State, they know that this is a more pro-life region of the state. And they were very receptive. They were open to the fact that, maybe we don't want this on our campus. Maybe this is not something that we want to get involved in. I mean, setting aside the actual moral issue of the sanctity of human life, just from a political issue, these are colleges. These are places that are supposed to be helping students learn. The last thing that I think they would want to do is to wade in to this very contentious political issue and take a side in favor of promoting chemical abortion on their campuses. And if you go back and you look at some of the testimony for this bill, Planned Parenthood, on average, there is a Planned Parenthood or other chemical abortion clinic that is on average located less than 6 miles from these 31 campuses in question. So we brought this up in our testimony, said it's less than 6 miles. Planned Parenthood responded, or not Planned Parenthood, Senator Leyva, the author of the bill, responded by saying, well, it's 30 minutes by public transportation. So I just want you to understand this. They're not arguing at this point, this is a dangerous situation, this is tragic, and we need to be able to serve these girls, these women who may be facing themselves in an unplanned pregnancy. Theoretically, I mean, again, setting aside the pro-life issue, just from a practical issue, girls can already go off campus, and many, many girls do, very sadly, go off campus. Young women go off campus at UC and CSU campuses and get first trimester chemical abortions. This bill is literally saying it's too inconvenient to do it. So we need to make it more convenient. We need to kind of just remove the barriers of taking a bus or remove the barrier of driving or taking an Uber. And I felt really heartbroken listening to the testimony of one young lady who was there talking about her chemical abortion and why she needed it. But she got up there and she basically said, it was very tough because I had to rearrange my shifts at work, and my boss was asking where I was going, and I had to leave early in the morning, and then I had to be gone, and, I had to go. And I'm thinking, you're talking about the taking of an innocent human life, and you're complaining that it didn't fit your schedule. I just think about that. Now, that is why I think it's so important and so vital as we are educating the next generation. I think that's why the work of Right to Life is so crucial, why the work of Students for Life is so crucial, because, like John said, we need to be there to persuade this next generation that if their friends are facing an unplanned pregnancy, they have better options. We need to be there so that as these young people grow up and become not only voters, hopefully they're voting now, but as they become older, as they maybe run for office, they are able to see through some of the lies that are being promulgated by Planned Parenthood and NARAL. And I will tell you that one of the most encouraging things that I've seen out of this so far, even though we've not seen it change a lot of votes in the Senate yet, we have some hope in the Assembly. Because when we started going around and following up, Students for Life did a lobby day at the Capitol, surrounding that one of those hearings there at the Capitol. And as we were following up with them a couple of days later, one of the offices that we called, they were asked, do you know about SB 320? Would you like us to explain it? And their response was, oh yes, we know about it. We had a large group of students come in. They explained it in detail. They laid out why this bill is, why they're concerned about it. Students make a big impact. And again, just because we're going and lobbying, it doesn't mean that we're going to change things on this overnight. But again, I want to go back. If you look at the history of other civil rights movements, if you look at the fight by William Wilberforce to abolish slavery, if you look at the fight by Dr. Martin Luther King and many great African American leaders to fight for full equality for African Americans, those battles were not won in a day. They weren't won overnight. They required consistent persuasion over and over and over and over and over again. And I will tell you, sometimes it can be really frustrating. Sometimes it is just, you vacillate between being furious that how could people be so stupid in Sacramento versus being sad. But when I come to gatherings like this and I see all of you and I know the hard work you're doing, I'm very grateful. So with that, I'm going to go ahead and wrap up. We want to make sure we have time for Q&A. Thank you all for being here today. Thanks for educating yourselves.